Hello and welcome. Today we have a special treat for us, our viewers. We have Mr. Jeremy Keim. Jeremy, welcome to our interview, our podcast, our video, whatever we call it.
Thank you. Glad to be here.
Folks who are listening today for the first time, Jeremy is an experienced professional. He has 20 years of experience in strategic healthcare, and his passion is in healthcare, mental health as well. So, Jeremy, welcome to our show, and if you call it, and then please go ahead and do your introduction, and then we'll ask some questions.
Excellent. Well, thank you very much, Rahul, for letting me speak with you today. My name is Jeremy Keim. As was mentioned, I've grown up in healthcare. Sort of started 10 days after college in an actuarial department, really gave me a strong foundation for the insurance side of the business. And have had an opportunity to work with large employers across the country, but primarily in the Northeast. But over the last 6 years, really focused on mental health strategy for employers. But having spent 20 years or nearly 20 years on the insurance and the benefit side, realized I wanted to get closer to care delivery and joined Brightside Health a little over 2 years ago in order to bring life-saving mental health care to those who need it most.
Fantastic. We don't get too often somebody from that space as well. So we are so glad that you're here today. Jeremy, I have a special interest in mental health and surrounding areas as well, but that might be for some other day. Today, I want to talk about. It caught my attention when we you shared with you that you write blog, you tell storytelling, and I was impressed how good you are at telling storytelling. So and your blog. So tell us a little bit about your blog, how it came about, and
Sure.
then where you are with that.
Yeah. So what's interesting, I should caveat that I was a math major, right? So I'm not a writer by training or anything like that. I do what I can. I think part of the importance of writing in general is doing the reps, right? What we do in healthcare, what we do overall is how do you communicate, right? How do you communicate effectively? So for me, one of the things, if I look back, it was approaching my 40s, was realizing I looked at my dad, I looked at his healthcare needs, I looked at his social healthcare needs, so physical health, mental health, social health, realized that I didn't want to get into a position where my only friends when I was in my 70s were my wife's friends' husbands, right? It's where a lot of men, once you get out of college, in particular, you tend not to make friends the way that you've been able to as a teenager and in your college years. And that can be lonely, right? I think that there's a overlap between my work and what I've done in my career and what I've started to look at sort of in my community. And so for me, as I looked at approaching 40, having two kids, I'm a girl dad, I've got two daughters, realizing that I want to be a great dad, I want to be a great son, I want to be a great brother to my brother and my sisters. I want to be able to support and be a steward of people in my community as well. I want to be a friend and realize that I had a story to tell in some ways, or at least it's a little bit big of me, but I realized I had a story to tell. And so a friend of mine and I started chatting about how do we start to write about it. And so started to come up with a concept that we call Project Kathekon. Kathekon's a Greek word that really at its core gets to improvement. How do you improve? How do you get a little bit better every day? How do you look at ways that you can be authentic about where you have opportunities and ultimately support them? And so I had an opportunity to start writing. So when I was turning 40 was my first piece that I wrote. There's nothing like the buildup to hitting send, the emotions and being able to actually put something on paper and share it with, at the time, a couple dozen people, not many. But the first story was about how I met my wife and how I changed things as I was approaching my 30s and meeting my wife and ultimately had a healthcare bent as well. And then over the years, work got in the way, right? So I wrote quite a bit and didn't have an opportunity to write as much anymore and ended up getting out of practice, but realized it was something that I missed. And so got back into it and realized that there's an opportunity to talk about what does it mean to be a man today? And ultimately, how does that relate to my own struggles, own opportunities that I've overcome?
Fantastic. You said Kathekon, that how we improve or continuous improvement, and that's a very important piece when we talk about mentoring in general, but especially in the healthcare field. I
Yeah,
do a lot of mentoring, and that is some of thing I teach, that we don't have to compete ourselves with anybody else. We have to compete ourselves with us.
yeah,
Last week, in this week, what new skill I've acquired, what new I've learned, how can I improve myself? So I think that gelled really, really well with. I got a chance to read, a couple of them, and then one thing which caught my attention was
yeah.
you talked about this thick and thin trust.
Yeah.
We know that trust, of course, and then how you're putting together the thin crust and thick crust pizza analogy, and then bringing that part in here, or just from that part of it. So tell us a little bit more. What is this thin or thick trust, and then
Yeah.
how it applies to us, as especially to our audience if they are in early career phase in medical field or otherwise.
Yeah, a couple of things. So the concept of thin trust comes from Robert Putnam, his book Bowling Alone, really talking about how over the last generations we've really lost touch in our communities. And the concept of kind of relating it back to pizza. I grew up in Connecticut, New Haven style pizza. The whole idea of thin and thick trust. So a little bit of humor in the article, but the concept of thick and thin trust. You think about your friends, those that are close to you. You have a lot of thick trust. There's a need for thick trust. Maybe not a lot of volume in thick trust relationships. So think about your deep friendships. You probably have a couple friends that you're really close with. But ultimately, when you look at studies, when you look at engagement, you look at improvement and wellness, sort of quality of life scores, what's really impactful is thin trust interactions. So think about going down to the store to buy a cup of coffee. Think about getting into your community to say hi to people, knowing your neighbors' names. Those are all thin trust interactions that over time, the way I sort of think about this is it's almost like money, right? And investment, and it compounds over time. And a little bit of those thin trust interactions allow you to start to improve your mood, improve your interaction, improve your assessment of how life looks. Interestingly enough, there's another article that just came out recently in the New York Times about drive-through culture, right? And how no one is getting out of their cars anymore, no one's talking to each other. It's thin trust, right? Those are all thin trust interactions that we're losing out on. And if you think about it in the healthcare experience, an average time seeing a primary care physician is very limited, right? But those are a lot of very small interactions in the primary care setting that can have a true impact. Think about loneliness, isolation that's occurring, the increase in that not only in elderly population, but younger. You look at teenagers. Look at myself. The reason I started Project Kathekon is I was lonely, right? I wanted interaction with others. And so as you look at that thin trust, if you think about the medical profession, a smile, right? When we're going into this conversation, a simple smile, a simple hello, holding the door open for somebody, those are thin trust interactions that could make somebody's day. And it is something that I see with my daughters. I see them and how they engage in their society or their community here. I see with fully remote work. Like I'm working from home now, right? You can see right behind me, right? It's hard, right? Fully remote work for me is really hard. And so I try to make an effort of on days that I can interact with others in a very quick way that to me gives me a lot of value. And I'm assuming that there's some value that's exchanged on the other end.
Absolutely. I think, pandemic has taught us a lot of things. It has changed my perception of work environment, and especially the importance of community and family members. Sometimes we have taken those for granted, and, we can always pat on the back saying, we survived the pandemic of the century. But that is not the last pandemic we'll see in our lifetime. Uh,
Mm-hmm.
as at the time of recording, there's one brewing right now, if it doesn't go too far beyond for that. So I think that's a very, very important concept, and it applies. It applies to everybody, and especially in healthcare field. The people from the patient and doctor side, but for learners who watches these videos a lot, that this is something they need to be paying attention to, especially when they get into career, and then paying attention to their own mental well-being, behavioral well-being, and as well as their patients and their colleagues well-being too. That's going to be very, very important for those as well. You storytelling, and I'm reading a book. I'm sure you've read that book called Story Worthy. It is by Matthew Dix.
Okay.
I'm becoming a fan of this book. There's no conflict for there as well. It has changed my life. And
Okay.
when I saw your blog and then your storytelling piece, and I've seen you given talks as well. So tell me, what is the one thing which is important for you when a young graduate or in medical field, or even a pre-med or a high school or a college kid, what is something you can tell that how they can enhance, and what is the importance for storytelling for you, and how they can learn and enhance their skills around it?
I think it's in a lot of ways, you think about a professor, right? It's, you publish or perish, right? I think part of storytelling is putting something out there. It's very hard to do. And so the first step was, and I mentioned this earlier, is hitting send is really hard. But once you do it, there's a little bit of euphoria. There's a little bit of, I put something out there and now I'm waiting to see if it's resonated with somebody. So part of it is you almost start with the end of just kind of get over yourself and be okay putting something out there. The second is humor is okay, right? Humor is a good thing. We're probably all not as funny as we think. But again, kind of going back to the first part, kind of get over that, right? Add your little humor. And I think the third part to it is kind of find your voice, right? And you can't find your voice unless you're authentic. And I think that there's a balance between oversharing and being honest, right? You don't need to necessarily give everything away. You can be transparent, you can share your story, but there's some things that you want to hold back because you want the reader or you want the audience to kind of fill in the gaps with themselves, and put themselves in the shoe. Because I'm a big reader, right? I think to be a storyteller, you need to be a reader as well. I think I've read 78 books this year. So I spend the time, I prioritize the time for reading. And part of it is I can read a book, fiction, and be transported to somebody else's story when I have no reason to be connected to them. And the reason that is that writer is authentic in and of themselves. You're able to, as the reader, transport yourself to whoever the storyteller is.
Fantastic. That's very useful. I hope that audience are watching. They could relate with that and then take some of these points. So Jeremy, before I let you go, I would like to see if you want to give a 1 to 2 or maybe 3 take-home message for our audience from today's discussion, what we have discussed.
Yeah, I think going back to thin trust, say hi, smile at somebody, hold the door for somebody, and almost disarm them with generosity of being a human. Right? Just disarm them a little bit. Think about if you're the first patient that you're seeing and the last patient that you're seeing in the day, or your mentor, you're the first person that you're interacting with. Try to make sure that you've left their mark on them, and a positive mark. I think the second is tell your story, right? Whatever your story is, be authentic with yourself. I think there's an opportunity where stories break down barriers and ultimately create connection that can be a teachable moment for somebody. If you think about somebody in the medical profession in particular, there doesn't need to be this doctor-patient relationship. There is some sort of connection point that people can relate to. And while, yes, there's not a lot of time, right? We have a number of patients that we're going to have to see throughout the day. It doesn't take a lot of time to build that trust. And again, it goes back to that thin trust example. And then I think the last piece is be authentic, right? Be authentic, be honest with yourself, be honest with others. And when you tell your story, put something out there. The worst that happens is someone doesn't like it, and someone doesn't like it, right? I think if it's true to you, it's going to be true to somebody else.
Absolutely. So smile at a stranger, hold the door, charm them with generosity. I like it. I think that's a really good message.
My mom always used to say, kill them with kindness, right? I know that's not a great, connotation, but if just be kind. I think that there's the big thing to that.
I think this will definitely use some kindness, and that is never outdated in any walks of life as well. So Jeremy, we really want to thank you for being here today. Thank you for what you do. Keep writing, keep telling your story, and thanks for coming here. We have to bring you back with the focus on mental health and behavioral health, and see what can we do as normal day citizens, and what our listeners who are coming into medical fields in America, they can do something about it.
I'd be happy to. Thank you for the opportunity.
Thank you so much.